Okay, we are one day out from doing eyebrow transplants for this young lady. Could you tell the audience why you wanted this done?
Well, I wanted the procedure done because I had a tattoo for over a decade, and the tattoo was showing within this area right here. It was really sparse hair, hardly any hair, just like a fine gray line for tattoo. And then the other hair was thinning, and you can see the line of the tattoo going through the rest of the brow. So every day I would have to put on eyeliner to conceal the tattoo.
Very good. Were you losing hair too? Is that part of the reason, or you just had always a thinner eyebrow?
Well, actually my eyebrows before the tattoo looked really similar to this, except for they weren't this close in. Okay. They were more in line with my eye, like the normal brow, which would be from here to here. Right. But when I drew the eyebrow for the tattoo, I brought it in some. So it kind of, but I actually love this look even more. I like this more. After the tattoo, my hair started growing really thin. It changed the pattern and the thickness of the brow. What
were some of your concerns coming here about the eyebrow transplant?
I really didn't have a lot of concerns. I'm just hoping that the recovery, like months out to a year from now, I still look like this, that they still stay looking as nice as this.
How did the procedure go for you yesterday?
The procedure went well. You guys treated me really well. I wasn't in pain. Good. I was really relaxed. Everything went wonderful. You, Dr. Lamb, and his staff was amazing.
How did last night go for you?
Last night went well. I did get the post-op instructions, and it said that I may have some bleeding, but the bleeding was minimal. When I tell you minimal, it was like the size of a quarter. Just one drop of blood on my pillow. Everything else was fine.
And how are you feeling today?
I'm feeling excellent. I didn't have to take any pain meds because I wasn't in any pain. And the swelling, it's minimal swelling.
Good. You wanted to add something about the prep for African American ladies that wanted to do this, or African American individuals. Could you help us with that? Okay,
so I really don't want to take off my cap, but for the purpose of showing black hair, yes, African American hair, and for the girls who know about hair types, I would be similar to 4B or 4C, which is the worst type of black hair, or worst type of hair, period, according to the charts.
What does that mean, a 4B, 4C?
It means really coarse, like woolly, tough hair. Now, when I put conditioner on it, it can get a little curly, but without any type of conditioner or chemicals, it's coarse like wool, like feels like woolly hair.
While you're speaking, I'm just going to be zooming in here just to do this in high definition. You can see how natural this is, even though it's I'm learning a new term myself, 4B or 4C. And that's a major concern people have, that African American female hair would look unnatural in the brows, but you can see how natural they look. Keep going, please.
Oh, and so that you're mentioning that, the hair type, I did go to a consult at another place back where I live, and they looked at me and they told me they couldn't do my hair because of African American hair. They didn't know how to do it, and that my hair wouldn't look right, it wouldn't grow natural, it would look weird, and they rejected me. So my daughter and I searched online, and we found you. And I saw the results from one of your patients. She looked great, and I was like, I'm going to Dr. Lamb.
Is there anything else to talk about the 4B or 4C? Is there anything else you wanted to mention, or did you say everything you wanted to say?
Okay, so when you give the prep for the hair with the special cleanse, I think it's HIBA cleanse, right, you can't put anything else in it like conditioner or things like that. So the HIBA cleanse can make your hair more brittle on top of the natural coarseness of the hair. Okay. So I did a lot of shedding in terms of prepping, and
so just so that the audience, whoever's thinking about this, won't be alarmed if they saw a little temporary shedding during the prep time. Was that your major goal?
Yeah. Oh. So it's fine. You'll have some shedding. It'll be really tough to try to comb it and get the get you to part it and get it ready for prepping for the incision.
Wonderful. Well, safe travels. Okay, so I think a concern or a question people may have is, you know, how do I harvest the hairs? Is it a FUE or is it a strip procedure? And it really, you know, for African American females in particular, there's just no reason to do FUE on it. African American gentlemen, we recently did an FUE because they wear their hair so short. But this gives us a really high quality grafts, quick recovery because there's no shading necessary. But this is just a day out, and this is going to really just disappear over time. You wanted to add one more thing.
Okay, so you, as you can see, I have quite an amount of gray hairs.
Right.
And even in the back, there
Yes.
are a lot of gray hairs. Dr. Land did a great job in separating the black and the gray because as you can see in my eyebrows, they're all black hairs, aside from maybe one little gray piece of hair that was already there before the procedure. Right. So,
I'll give that credit to Amina. She's the one that separated the hairs.
So
I just
these,
did the design.
they do a great job. I asked her to try, and she did. She skipped every piece of gray hair, so they're all black hairs. And this is what 4C hair looks like. And if I could take it out the ball, it's really long and full. So this would be the concern for African Americans, but it is doable.
Beautiful.